Columbia Morning on News Talk 1400 KFRU. We're going to talk about something that I feel is pretty important for the community and also for the mental health of children in this community. And we'll talk with Dr. Laine Young-Walker about this. She's in the studio with me. It's called the Bridge Program. Good morning, Doctor. How are you?
Good morning. I'm doing well this morning.
First of all, congratulations, those who went to the Athena Awards program. And we had one of my coworkers here very impressed by the work that you do. And congratulations on winning an award there. I appreciate you coming in and sharing what was part of what was the recognition there, but congratulations on that.
Thank you very much.
You are the Associate Dean for Student Programs, University of Missouri School of Medicine, correct?
Yes, I am.
Let's talk about the Bridge Program. When we're talking about that, we're not talking about putting a new bridge over the Missouri River near Roachport. We're actually talking about something that is, I think, in many of the schools in the Boone County area.
Yes. You know, when there was a push to get the children's mental health tax, there was an environmental survey here, and it was found that there were long waits to see a child psychiatrist, lack of insurance, underinsurance, all of those things prohibited parents from seeking help. And kids had mental health issues. So we really put our heads together and came up with the Bridge Program, myself and a nurse who kind of brought that idea to me. It's a program where we can see a kid in a short amount of time in the schools for their initial psych eval and their follow-up visits, stabilize them while they're waiting to get into the community.
So is this available at each level of school, elementary, middle, and high school?
It's available to all schools in Boone County. That includes public schools, private schools, parochial schools, and homeschooled kids. We take care of any child kindergarten through graduation.
When did you start this?
We started it in a pilot in 2014 for about 3 months, got some data to show it was effective, and then went to the board to apply fully in 2015.
So it's got some history to it now, 4 or 5 years of using this. If you were summarizing what are some of the most important impacts that this has had, what would you say?
I would say that the support that is given to these families is tremendous. We have nurse case managers who connect with the parents before the appointment and after. I've had some parents say things like, the Bridge Program saved my child's life. I wouldn't know how to access mental health treatment if it had not been for Bridge. And so being able to get in and help a child quickly versus waiting 3 months, 6 months, I think is critical to reducing some of the symptomatology.
I think I read someplace also where some families would be lost in trying to navigate. So where do you go? How do you do this? I mean, I guess you could go to your family physician and say, we're dealing with something other than a physical aspect. It might be a mental issue. Could you help guide us? But I don't know if some families would be comfortable doing that, nor do they even think about doing that.
So really, most children will see their primary care provider before they see a child psychiatrist. There's really a shortage of child psychiatrists, which is part of the issue. But we take referrals in Bridge from primary care providers, counselors, the coalition who's in the schools, a parent, anyone who feels like they need an assessment.
So why is it called Bridge Program?
Well, we're bridging the gap. We're bridging the gap between that initial treatment and then the long-term treatment. And so we make sure that everything we do, all of those records go to the next provider so they don't have to repeat everything.
So let's go through a fabricated scenario here. How does this work? A teacher in a classroom notice a student maybe withdrawn or acting out or something? Make up a scenario and tell me how this would work.
So you could have a child who's either having lots of issues with sadness, depression, or anxiety, or even aggression, acting out behaviors. And usually that teacher will refer or talk to the counselor in the school, and the counselors have a great relationship with our Bridge nurse case managers. They can make a phone call to one of our nurse case managers to make an automatic referral.
So so then the nurse case manager would go to the school.
So what happens next is that the nurse case manager contacts the parent and says, we want to talk with you a little bit because your child's been referred. Usually we want the counselor to have told the parent, so it's not a surprise. So they're expecting it. And so we go through a series of questions to understand better what's going on with the child, and then ask the parent, is it okay if we see your child in the school? And then we go to different schools. Every month there's a schedule where we're physically at the schools. And so we are at the school with the child psychiatrist, and we see that child there.
Do sometimes the needs mean you have to come quicker than that monthly schedule? And so you would, I think you said this earlier, you would respond immediately in certain cases.
So say, for instance, we're not going to battle until 3 weeks from now, but this child really needs to be seen. We may sometimes ask the parent to bring the child to a different school so that we can see them in a more quick fashion.
So what happens after these meetings, and how many are there? And then what's the case? What happens? What's the situation afterwards?
So there's an initial psychiatric evaluation, which takes about an hour, and we do want the parents to be present. It's great for them to be present for everything, but if they can't come for the follow-up visits, we call them. We don't make any changes or adjustments to medication without approval from the parent. And we're really assessing, is there a psychiatric diagnosis that requires medication management or other treatment? If it only requires therapy, we'll refer out to different therapy options or different parenting groups and things like that. But if there's a medication need, then we'll follow up for about 3 more times monthly, just to make sure that they are stable. In that time, we make that referral to Compass Health or Burrell or Woodrail, so that while they're waiting to get in, they're being treated.
Who are the nurse case managers? I guess my question is, where do they work normally, or are they just hired for this particular job? Or
So this came from an idea from Carol Schutz, and she was a psychiatric nurse on the inpatient unit for child. And so she's now full-time with Bridge. A nurse case manager on that unit also is full-time with Bridge. Her name is Chris Petner. And then Anna Compton is a nurse that we hired. So they're all full-time. This is their only job. But they were doing psychiatric treatment at either the youth unit or even at the VA in the past.
what kind of numbers are we talking in a given month or year, however you look at the numbers?
We treat about 400 youth every year.
School year?
Every school year. And so we're not continuing care like a clinic would be. So we're bringing in new youth, stabilizing them, and then moving them on to outpatient treatment, which could be a primary care provider.
400, is that a surprising number to you or a lower number than what the needs are? How would you interpret 400?
It's surprising, and it's surprising that every year it seems like we get more and more referrals, and that we, with unlimited resources, could see more kids.
I hate asking this question because I think it's pretty, I don't know, I just don't like asking money questions, but how's this funded?
So the Boone County Children's Services Board is the board that was created after the Children's Mental Health Tax passed, and they have funded us. We have to reapply every 2 years, so it's not guaranteed to be, into infinity.
Yeah, that's what I wondered if I knew what you said, and I know of that tax, and I think that this is a great example of something that is being done very positive and very important. You saw the need for this, and you said, can we construct something that would work for this?
Yes, and Boone County wants us to show outcomes. So it's not just here's the money, do your work. Here's the money, do your work. What are your outcomes? Let's measure them and measure the success of the outcomes. And then that's what I think they base our continued funding on.
Do you know what happens to young people who have maybe been helped immediately, but then you refer them on? Do you have a way to measure how this has helped them?
So we do some satisfaction surveys, and we also do measurements of symptoms while they're in our program. After we move them on, we just have word of mouth from the providers. Sometimes the providers may call us back because they're having maybe a bump in the road and they need some help, but they're able to manage that with the assistance we can give.
So what would you be your final word to listeners who would say, well, you know what, I don't know anything about the Bridge program, or maybe I heard a little bit about the Bridge program. What would you like for them to have in their mind?
I just feel like this is a wonderful program that's filling a need in Boone County that wasn't met before. And the counselors, the teachers, the parents, it's amazing the support that we have from the community in what we're doing with Bridge. So I would say, just if you're having any child at all in Boone County, whether they're homeschooled or in private school or public school, and you feel like they need to see a psychiatrist, use the Bridge program.
And the psychiatrists are not the nurses, but they are the people who would be referred to.
Right. So it's actually a nurse and a child psychiatrist in the room together doing the appointment. And so the child psychiatrist is doing the evaluation. The nurse is there to assist, and they're there to engage with the family after the visit to see how medications are working, if there are any side effects, to make sure they're available.
Seems like this would be very fulfilling. I mean, you have to feel good about what you've been able to do.
I'm excited that the Children's Mental Health Tax has allowed us to do a lot of great things for kids in Boone County.
Do you think in the med school that there are young doctors who want to go into this kind of work that are very concerned about mental health of adolescents and young people?
So I work with psychiatrists, child psychiatrists, and medical students. And I have a lot of enthusiasm from medical students wanting to go and shadow in Bridge, wanting to understand some of the programs. So I think it's definitely catching on.
Well, thank you for having the idea, you and your partner there who came up with the idea and said, you know what, we could do this. This is a need that's not being met, and I appreciate you explaining it, and then also the county for backing it. I think that's pretty neat to be able to say it's a program that we find value in.
Well, thank you very much.
I appreciate your time being here, Doctor. Dr. Laine Young-Walker, Associate Dean for Student Programs, University of Missouri School of Medicine, talking about the Bridge program. And I guess for any people who are listening, guardians, parents, or others concerned for young people, you could get information probably in any school, through any school about the
Yes,
Bridge
you could.
program. Thank you. It's News Talk 1400 KFRU.